We're back with another, again, still don't have a name for this, guys. These pop-up podcasts that I'm doing with all of our experts at Good Cop in Panama. I got an American with me this time now. I've got Adam Hoffer. He's Director of Excise Tax Policy at the Tax Foundation. First of all, thank you for coming. We're excited to have you as an expert and another fellow American tax organization that's doing a better job at spreading information about harm reduction than the World Health Organization is. Can you kind of introduce yourself to our listeners and kind of like talk about, what you do at Tax Foundation?
I'm happy to, and thank you for the invitation to be on. So again, my name is Adam Hoffer. I'm the Director of Excise Tax Policy. I work all day on taxes, which, again, I realize most people think is not that interesting of a topic, but I like to joke that I have the most interesting job in the tax world, in that I handle things that get excise taxes. So these are special taxes in addition to your broad-based sales taxes, and certainly different than income taxes. So these are goods that get singled out for taxation. So I spend most of my day working on products that involve nicotine, alcohol, cannabis, or sometimes working on sports betting and other really fun stuff. So I study tax policy, again, from an excise standpoint, these products that get their special taxes applied to them. We study why these taxes are applied, what rates should look like, and then the ever-evolving landscape, specifically that we've seen in nicotine and tobacco products over the past 10 years, has really changed the whole way that we think about excise taxes on tobacco and specifically combustible cigarettes. And it's been fascinating to study, and we have a lot of policy insights that most of our work is focused on the United States, but similar policies that we see being implemented around the world are absolutely applicable, and a lot of what the World Health Organization is saying we think is either misleading or at the very least lending itself toward poor policy.
Yes. And for our listeners who don't know, the Tax Foundation does these really cool annual reports that I rely on myself, looking at excise taxes broken down by every state. And they have got, how high are tobacco taxes in your state and how high are vapor taxes in your state, the official title of those?
Yeah, I think so. So it's really fun. Probably once a month, I put out a good data release of how high are the tax rates in your state. So we'll do tobacco taxes, vaping taxes. We'll do marijuana taxes for the states that allow marijuana. Absolutely.
OTP,
yeah. And so if you're looking for data related to tobacco or almost anything else in the tax world, you can find it on the Tax Foundation website.
Yeah, it's fantastic. I use it. I rely on it when I'm looking at what is the price on that tax on that cigarette in that state right now, and it's really good work. Okay, let's go look at the prohibitionist policies. Are you seeing any of that reflected in tax data? After, I know you guys have done some work on, for our listeners who may not be aware of it, Massachusetts banned flavored vapor products, flavored tobacco products, and this includes menthol cigarettes. And they did that back in 2020, and we just had California, which pretty much all the localities were already under a flavor ban before they did the statewide one. But can you talk more about what you're seeing in tax data, in the wake of those bans?
Yeah, most of our work is deals with tax data, and these regulatory prohibitions were not something we were going to wade into. But then we looked, and these have really big revenue impacts. I think a lot of people don't realize how much money states and the federal government collect from cigarette taxes. Whenever we evaluated the proposed federal menthol ban, we estimated that it would cost state and the federal governments a combined $6.6 billion a year in tax revenue.
That's just lost revenue. That doesn't include cost of enforcement.
Correct. Just lost revenue, lost money coming in the door from, again, the cigarette excise taxes and the sales taxes and MSA payments, all the extra revenue that states and the federal government get from cigarettes. So whenever we started looking at these local, or state-based flavor bans, we realized that there were some really big revenue impacts that were going to be coming down the line. We've seen that the Massachusetts experiment in this has really seemed like a disaster. I'm really surprised that other states have decided to follow Massachusetts' lead. In Massachusetts, we saw roughly 9 out of every 10 packs that were no longer sold in the state after the flavor ban, we could track via the tax data to increase in sales in neighboring states. And so compared to their existing trend, we didn't see any statistically significant decline in overall cigarette consumption in Massachusetts, but they lost millions of dollars a year. And again, almost all of it is picked up in neighboring New Hampshire and then some in Rhode Island as well. The California ban has been a little bit different. It's still really early. We have some early tax data, but California, for those of you who know the United States, is very different than Massachusetts. Not only from a geographical standpoint, a political standpoint, really across the board. They're very different areas. But California doesn't share large land borders with a bunch of different neighboring states like Massachusetts does, or at the very least, the population centers in California are really far away. You're not going to drive 4 or 5 hours round trip to Nevada just to buy a pack of cigarettes, or if you are, then you're going to buy an entire year's worth, because that's not a trip that you're going to make very often. But California does share a land border with Mexico, and they also have some of the largest ports in the entire country. And so the data for California was a little more interesting to get. A different organization hired out what we call a discarded pack audit. I like to call that just people digging through public trash bins.
Yep. The trash study.
And they pulled out over 15,000 discarded cigarette packs. And the real question we were looking at is, they collected this the 6 months after the menthol flavor ban in California, and they wanted to know, are people still smoking menthol cigarettes? And the answer was overwhelmingly yes. We saw about a 3 percentage point decline in menthol share of all discarded packs. And so it was very obvious very quickly that people are still consuming menthol cigarettes in California, but none of those sales are coming from legal sources in the states. The overwhelming uptick was from either products that were designed to be sold outside of California and may have just disappeared out the back of some warehouses designed for export. And it was those, and then an awful lot of products coming in from Mexico.
Yes, I saw that study and I thought it was amazing. And I'm like, why aren't we doing this every year in every state, actually, just to see, get a more an idea of the tax evasion, I guess is the best way to describe it. I know. I mean, I used to live in Illinois and Missouri. I think it's got the cheapest state excise tax in the country. And it's funny because they have limits on how many cartons of cigarettes. If you go to like some towns by the border, they got like signs out like you can't buy more than this many cartons of cigarettes, because I mean there is an incentive for people. New York, I mean you guys do a really great report. I mean it never changes. New York is still the worst place in the country as far as cigarette smuggling. There's another way to, that you guys describe it that's a little bit fancier than what I can say right now. When looking at these tax policies, I mean, one of the reasons that the governments put them up is to kind of deter people from using these products. Do you see if these taxes are working and helping reducing smoking rates like that?
Yeah, I think one of our big jobs is to highlight the things that don't get a spotlight put on them right away, right? So it's really easy to measure. And I remember just months after the Massachusetts ban, there were, essentially banners being waved, herald champions of public health, because all of a sudden legal sales fell. Well, yes, legal sales fell. Did anybody check and see if consumption fell? Because it didn't very much. And so one of our jobs in studying things like smuggling and all these other unintended consequences is to showcase the fact that, yes, this policy is intended to do one thing, but it's going to do an awful lot of other things. I think the overwhelming message that we try to report with public policy and tax policy is that public policy should improve the well-being of the citizens. That's what public policy should aim to do. And now, if you're going to improve some people's lives, but you're going to ruin an awful lot of others, then there needs to be a discussion of these costs of the policy, these unintended consequences that are sometimes, very real and have very real effects on the well-being of people. Smuggling, I think, is the perfect example of this, right? So not only are people still continuing to consume the products that are intended to no longer be consumed, but now you're just pouring money into illicit markets and all of the other things that come with black market activity, right? These are a cash cow for illegal operators, for people who are willing to take the risk, right? There's a ton of money to be made just through cigarette tax evasion. It's such a trope. It's part of the movie Goodfellas, right? And that's based on stuff going on 50 years ago, but people selling cigarettes out of trunks of cars. But that still happens today. People selling Lucy's on the corner for $1, right? So these policies have very real effects beyond what their initial intentions are, and I think it's our job digging through the tax data to show what some of these other unintended consequences are.
And I think for my last question, so the United States doesn't have a federal excise tax on vapor products, but there's about 30 states now that have implemented an excise tax. What are your thoughts on these taxes on these vapor products? And I mean, obviously, we want people to be using them, so an excise sin tax on them is kind of counterproductive when you're trying to get them to switch. So if you can talk more about that.
Yeah, I think our basic fundamental philosophy here is that it's possible that vaping products still cause some harm on their own, so it's not necessarily that there should be no vaping taxes, period. But the thing to emphasize is that any smoker who switches from combustible cigarettes to any other nicotine product sees a remarkable improvement in their health. So from a public health standpoint, getting any smoker to switch to any other product should be considered a giant win. Vaping products really provide a tool that a lot of smokers find useful in quitting smoking. So what we want to see are tax rates that encourage price differentials so that vaping products are still price advantaged compared to a pack of standard cigarettes, right? So you can apply a really low rate, something like 5 cents per milliliter on vaping products, and not make the price so egregious that a vapor now needs to pay twice as much for their vaping products as they would for a pack of cigarettes. And really, we're seeing arguments that in some state houses, but then also I think Senator Chuck Schumer came out with this, anti-Zyn nicotine pouch, right?
This like 5% of America who even uses them.
I mean, this wave of nicotinophobia, where all these policymakers are so terrified of all nicotine products, even though some of them are just extraordinarily less harmful than cigarettes, and some may have no discovered harms yet whatsoever. It seems fascinating to me that we would promote things like nicotine gum as a smoking cessation tool, and then all of a sudden we get similar products, maybe better, that consumers like. I think the biggest win in the public health space for Zyn so far has been a better willingness for female smokers to switch to these kind of nicotine pouches that are just very different than what you would think of as a traditional snuff product. But we see people that are willing to switch and change their consumption from combustible cigarettes to something that has very little or possibly no harm. And yet, again, there's a call for equal tax rates on these products, which is just ludicrous and is in no way the way in which to promote public health.
Absolutely. So a couple of final thoughts. Anything to say to the WHO?
I mean, I have a lot of thoughts regarding the WHO. I've been reading a lot of their work. Again, this idea of nicotinophobia seems to be sweeping not only the country in the United States, but also the world, and seems well embedded in the World Health Organization. I struggle to see an sound academic justification for a lot of their policies in being so anti-harm reduction products. I think that harm reduction products can save lives. I also think that there's a pretty clear consensus in the academic literature that these products are far less harmful. And so, again, anything that's we can do from a public policy standpoint to encourage combustible cigarette smokers to switch to alternative products should save lives and should improve world health. And so that is the kind of policy I would expect the WHO to promote, but that is certainly not what we're seeing.
Fantastic. Well, that was perfect. A perfect closing. So thank you again, listeners, for listening to our podcast during Good Cop. Make sure that you're watching our live stream and checking out all the other podcasts with all of our awesome experts. Thanks.